Hi, my name's Dr. Dick Walker, and I'm coming to you from Spokane, Washington. I've been a physician for over 40 years. I'm an ER doc, and I am still practicing medicine. But I was first introduced to ASEA about 5 years ago. And at first, I wasn't real sure what this product could do. But I tell you, I've seen it do amazing things over the last 5 years. And I used to wonder, how is it that the body, somebody can come into my ER with a horrendous soft tissue wound, and I might spend an hour or two fixing that, sewing all the different tissues and different layers back together. But in actuality, what happens after that? Because the body takes over then, and the body has to know what to do for that repair to take place. Or when I took the stitches out, 10 days later, it would just fall apart. And what I've come to realize is that redox signaling molecules, the active ingredient in ASEA, is absolutely crucial for the body to repair. But our body is repairing minor things 24/7. You've got cells that are deteriorating, aging, breaking down, needing to be fixed or replaced. And if you think about it, how does the body know which cells need work? Well, these redox signaling molecules are what tells the body that a cell needs to be repaired or replaced. And so a lot of people come to me and say, well, how long does it take before ASEA starts to work? I think what they're asking is, how long will it take before I notice it? Because ASEA starts to work from the instant you put the first mouthful into your mouth and swallow it, because these molecules get absorbed right away, and then they go to work facilitating your body's ability to fix and repair cells. But the question of how soon will I notice it is a little more complicated, and that depends on how sick you are. Because as you're repairing cells, if you've got billions of cells that need repaired, it's going to take a little longer than if you've got 100 million or so. So the figure that we often talk about is that about 25 to 30% of people will notice something within the first 30 days. But if you go out to 90 to 120 days, 3 to 4 months, about 90% of people are going to notice some positive changes in their health. And every case of ASEA has a document in there called the results tracker. And that's in there for a reason, because the best way for you to notice results, the earliest, is to baseline your health by filling out that body tracker. And then at the end of 2 and 4 weeks, go back in and revisit those issues. At the end of 2 months, go back again. And what you'll find is that initially some of these results are fairly subtle, but you will see a change within 90 to 120 days. And remember that you may need to increase your dose to kind of kickstart your body's ability to do the best it can at repairing.